We bring Dr. Benjamin Busfield to Deer Valley High School tonight to talk about sports injuries and prevention. Dr. Benjamin Busfield is the medical director of sports medicine and an orthopedic surgeon at Sutter Delta Medical Center.
Your body and your shoulder and your elbow are a finely tuned machine. You don't want to abuse that machine by using it too much too quickly.
A passion for sports, a former consultant for the LA Lakers, Sacramento Kings, and Anaheim Ducks. Coaches, parents, and athletes filled Deer Valley High School to hear recommendations on how to prevent throwing injuries.
We all pitch a lot and we all don't want to get hurt, and if we can all stay healthy and help out the team in any way.
Well, I think it's always good to have as many people as possible hear about some of the injuries that youngsters take on through athletics. Being an athlete myself in high school, I wish we had more information like this.
How do I know when a pain should be addressed? How do I know when to back up on throwing? And how do I know how to appropriately limit my pitches to prevent injury?
A player's age and when they start puberty play a critical role in their joint development and mechanics of throwing.
This is a video of maybe a 6 or 7-year-old athlete throwing the ball. You can see it's almost all arm. There's very little of leg kick. It's almost like standing still arm throwing, a lot of stress on the upper body. You see there's a huge difference in the velocity, the mechanics, the control.
Counting the number of pitches is important, not just the number of innings.
Use a pitch count when you throw.
Overuse can cause injuries by playing year-round, playing the pitcher and the catcher, and playing in multiple consecutive leagues.
Really, no one else does. Pros don't do it, so why are they having you guys do it, especially as pitchers?
To prevent injuries, avoid overuse, coach mechanics and control, not speed, and pay attention to persistent pain.
It's normal to have pain for a day or two after having a pitching start. But when it goes on beyond a few days or starts to occur daily with throwing or even at rest is worrisome and needs to be addressed.
Yeah, I learned that it's better to keep your arm in shape, ready for season.
I think that this is something that should be presented to a lot of young kids at a young age, so they know, when they're playing baseball, what's really important is to count the pitches, practice and games.
It's phenomenal. I think every commissioner and every parent should actually see this presentation. I have an 8-year-old son who is wanting to pitch, and the pitch counts and the warm-ups and counting, all of that was very insightful.
Sutter Delta Medical Center is your hospital close to home.